Right, good morning. It's May 26th. This is a special meeting of the Marin County Board of Supervisors. We are holding this meeting virtually in compliance with local and state shelter-in-place orders and as allowed by Governor Newsom's Executive Order N-29-20. We do have capacity for real-time public comment through the Zoom website or the Zoom link, and you can find that at marincounty.org/departments/BS meetings. It's the Board of Supervisors webpage for meetings, and there are instructions on the screen there. And there will be instructions appearing on the live feed as well. Let's see. So with that, I'm going to ask Diane for a roll call, please.
Supervisor Rodoni.
Here.
Supervisor Arnold.
Here.
Supervisor Connolly.
Here.
Supervisor Sears.
Here.
Supervisor Rice.
Here. Right, so we're going to go straight to, we have two items this morning. The first is a report on the Marin Recovers safe and measured reopening plan. And I believe that Max Corton, who was our lead on this project, is going to kick us off. Morning, Max.
Good morning, supervisors. Max Corton, Director of Marin County Parks, and coordinating the Marin Recovers Advisory Group effort. So I wanted to start off here, and actually maybe we can just go to the next slide.
Can we get full slide view as opposed to having the full screen view?
Start the presentation.
There we go. Thank you.
So I wanted to start by thanking Angela for all the slides and the leadership. Thanks to Supervisor Rice and Supervisor Rodoni for their leadership as the subcommittee that was leading this effort. And as a very brief overview of what we're going to talk about today, this is describing a process that, we work to put together quickly with a lot of partnership and collaboration from cities and towns and local government here in Marin County, and also especially from community and business leaders from the county. And the goal of the effort in the briefest way was to figure out ways that different sectors of our community and our businesses could reopen in a safe way. One thing to point out before we get too deep into this is that, this really combines and nests within a larger Marin recovery effort, and that there is a Marin recovery economic group that is led by a subcommittee also of the board with Supervisor Connolly and Arnold, who are going to be continuing even beyond this effort, which is really about creating guidance for industries to reopen, to look at a broader way of what kind of support our businesses and our community might need going forward into the future, and be adaptive and connected to that community. And so I wanted to thank that group and the subcommittee also for helping to provide additional guidance to this effort. Let's see, I want to just quickly also thank the steering committee and all of the business and community members who pitched in, and maybe we can go to oh yeah, here we go. This is the steering committee. So really this effort was about convening different industry groups with different business sectors. So really looking at the industry-wide standards, but also looking at it from a Marin angle of the businesses that we serve and what would be meaningful to them. But we also wanted to check in on a broader level with individuals who are leaders and understood the economy in Marin County and businesses here overall. And so that's what the steering committee's role was checking in on this process to make sure it was the right one for Marin County and giving us guidance from a business aspect. And to call out here that a couple members of the steering committee, especially Brian Colbert, from the town of San Anselmo, who's the vice mayor, will be helping to present today with me. And then additionally, Christina Lilovich, who was one of the group leaders on the retail group, is also going to be partnering on the presentation today. So let's see, we go to the next slide. So again, the Marin Recovers effort is a partnership that started actually after the 2017 wildfire season, after the North Bay fires, when looking at the lessons learned from Sonoma County, we recognized that the public information officers started working together on a website that could help our community recover from a major disaster like this. And so, you know, a huge thank you goes out to the cross-jurisdictional work of the public information officers who started working on this website years ago with a lot of foresight, and to recognize that the website and Marin Recovers itself, again, is much broader than the advisory group process that we're going to be describing today, and provides a lot of resources to the community around recovery and reopening. And again, as I mentioned before, the subcommittee that includes the mayors and council members group is again focusing on economic recovery countywide at a larger scale. And so the website is marinrecovers.com. There's the URL there. And all of the information we're going to describe today is available at that website, including guidance and ways to engage. I'm going to go to the next slide. So this is just describing the guiding principles of this work. And, you know, the first one there.
Max, you're turning it over to Brian.
Oh, sorry. Thank you. Brian, jump in. This is Brian Colbert, the vice mayor from San Anselmo.
So Max, we're actually trying to get Brian back on the call. So if you could carry it until Brian gets back on. No
problem. So, and let me know when he's back on, because he's got the next two slides here. So the first, or the ground level of everything we're doing, is complying with the state public health orders. And so the way that it works is that we, essentially Marin County, can't be more lenient than the state.
Max, it's Brian. I think I'm back on. Thanks a lot, Matthew.
Thanks, Brian. Okay.
Yeah. So Max, thanks for that lead off. Hi, good morning. My name is Brian Colbert. I'm the vice mayor of San Anselmo. And along with Kate Collin, vice mayor of San Rafael, we're the co-chairs of the Marin Council of Mayors and Council Members Economic Recovery Ad Hoc Group. Before I dive into the slides, I really just like to say a few thank yous. There's been so many people involved in this momentous effort. I'd like to thank the entirety of the Board of Supervisors, Supervisors Rice and Rodoni for their leadership on Marin Recovers, Supervisors Conley and Arnold for their leadership for Marin Economic Recovery. I really would like to thank all the county staff, particularly, highlighting the contributions of Matthew Heimel, Max Corton, Kevin Wright, Angela Nicholson, also Christine Elievich, and of course, Dr. Matt Willis. So many people participated. The Marin Managers Association, the MEF, the Marin Small Business Development Corporation, all the local chambers, of course, all the members of the MCCMC Economic Ad Hoc Recovery Committee. Special thanks to Joanne Webster, head of the San Rafael Chamber. And really, I know I forgot so many people, but I really just have to again say, so many thanks to Kate Collin, the vice mayor of San Rafael. She brought all of her formidable talents, her intelligence, her integrity, and her commitment to this process. So with that, I'm going to dive right into. I believe, Max, this deck is going to be shared with everyone watching the Zoom, right? So I'm not going to go over each of them, but what I do want to talk about is four of the underlying philosophies animating these guiding principles. And the first and the key one is the need to comply with the state public orders, while the county figures out how to either restrict or loosen those orders based on public health data. The second is employing a malleable organic process that will allow businesses to succeed during these challenging times of complex uncertainty while protecting the public. The other thing that Marin Recovers is really focused on is maintaining a structure that is iterative, so we can capture information and respond to queries from the business community and other stakeholders about the economic climate and how they intersect with our public health challenges. We really want to focus on minimizing the challenges and costs with opening and closing businesses during this process as the SIP evolves. And finally, and perhaps most importantly, I think we want to be sure and acknowledge the crucial role that each one of our locals and tourists play in supporting our local businesses and accepting personal responsibility for properly employing PPE. Next slide, please. Great. So this slide, again, which is available, this slide is highlighting the roles, responsibility, and process that Marin Recovers has set up. And so I'm going to direct your attention to the three-part graphic here. And there's three essential roles that are going on. The first is the role of our Marin County Public Health Officer. And what they're doing is they're taking the information from the directives of the state and then designing them for policies here to protect the public in our county. The second group over here on the top left in red is the Marin Recovers Advisors. And these groups, led by the supervisors, which Max will dig deeper into on the next slide, they're the industry, community, healthcare, and workforce leaders, which are connecting to the public officer. And I think it's important to keep in mind that these groups are diverse in terms of size, geographic location in the county, and scale. They're providing critical real-world feedback, so our public health policies and directives can be successfully implemented in the county. And finally, and certainly not least, is our local healthcare coordination. And this is the coordination involving our hospital, physician's office, our skilled nursing and group home facilities. With that, I'll turn it back to you, Max.
Thanks so much, Brian. So this is an overview of the working groups that were put together. And, you know, one of the things that's been really great about this process is how adaptive it's been and how much, you know, we've been able to sort of respond where there's an additional need. And so many of these groups created subgroups. And so, you know, you can see here there's a specific lead mentioned, but agriculture, construction, creative, education, faith-based organizations, health, dentistry, hotels, libraries, it goes on. There's many groups that were included. And, you know, one of the things, so as an example, you know, for instance, in parks, there was, you know, a group that was, you know, doing kayak rentals who got together. There was a group, you know, there's a group of charter fishermen who got together to engage. So there's been a lot of engagement of some of these subgroups. And I think that's one of the benefits of this process is we're able to work with the leaders from these different businesses. They can connect us with industry-wide guidance from other counties, from the state, from other jurisdictions, and that can help to inform our process, and we don't have to reinvent the wheel. And we can make sure that it's something that's meaningful to the businesses that we serve. Want to go to the next one? So what has opened and what's planned? I think this is sort of where the rubber meets the road for this work, because I think as we get into this, you know, we can hear that local businesses are just really eager to open and at a really challenging point in terms of staying in business during this time. So, you know, for a little while, some outdoor businesses like construction and landscaping have been open. Last Monday, we reopened local parks, especially in Eastern Marin, so city and town parks and county parks and open space preserves with certain guidance. Curbside retail was also opened last Monday with guidance coming out of the group, and a huge thanks to that group. And in a minute, I'll turn it over to Christine, who's going to describe the work of that group. Pet grooming was reopened also. That was on Friday, and guidelines were released for that group to start with drop-off pickup service. Golf and tennis were reopened, and some guidelines have come out over the last couple of weeks from the groups working on that. outdoor equipment rental and fitness classes for businesses that had some kind of outdoor presence in the past were released on Friday, and those businesses were allowed to reopen. And so those are some examples of what's been reopened coming out of these groups in the last week or two. And we have a lot more work to do. I think we have, almost every day this week, we have a meeting between the leads from the groups and myself and Kevin and Dr. Willis to sort of discuss how these next stages could go. But we released guidelines for summer camps and childcare to reopen on June 1st. We're working on how coastal parks or beaches might be able to be reopened in similar timing. Office space is one of the things that we're working on potentially reopening on June 1st. Retail outdoors, we're working on potentially opening June 1st. Restaurants, we're working on potentially opening. And there's some asterisks here, just to note that we can't get ahead of what the state has allowed, but we're trying to forecast a little bit where we think the state might allow some of these things, so that as they're potentially allowed by the state, that Marin County can react as quickly as possible and as safely as possible to make sure that these areas of business or community sectors can reopen. There's certainly a lot of other sectors as well that have engaged that we hope to discuss and work on reopening in ways in the near future, including churches, real estate, a number of other things, charter fishing boats, as I mentioned before. So both big and small. You want to go to the next slide? And Angela, let me know when we get to Christine's on number 9, because I can't see the numbers. This is just a little bit of the workflow of how this work has been progressing. So a couple of weeks ago, the industry groups were put together, comprised of people from local businesses, and the members of the groups are posted on the marinrecovers.com website. They worked with a lot of other folks from these industries, and some of we also had a core group, which deserves a huge thanks, of Kevin Wright, Kat Connect, Michaela Rowan, and Alex Portashaver, who worked tirelessly to study the state guidelines that have been coming out almost daily, industry-wide guidelines, federal guidelines, to help support the work of these groups so they weren't reinventing the wheel. After these groups put together potential guidelines, Kevin Wright, myself, and Angela Nicholson have been conducting regular meetings with Dr. Willis to review the guidelines along with county council and to revise them if needed. And then as soon as they're able to be adopted, we are working with our communications team and Lainey Hendricks from our public information officer to post them on the website and provide updates to those businesses so that they can reopen. And once they're able to reopen, another huge thanks, the site-specific protection plan was also part of this effort, was developed by the retail team especially. And that's really a blueprint for how businesses can reopen, and it allows them to figure out how to train their staff, how to manage their site. And I think Christine's going to discuss it a little bit more in her part of the presentation. And then, I think one thing to highlight is that this is an adaptive and iterative process. So, as we vet changes through Dr. Willis, we would follow up with the industry group to make sure that those make sense from a business perspective as well, and then reconvene to approve the final recommendations. And then Dr. Willis is continually monitoring the data on health in the community to adapt what we're able to open or not. And I think he's going to touch on that a little bit later in this presentation as well. And then, I think after this, these groups don't go away. I think as we predict that this is going to be a continually changing situation, we want to keep the connections between these groups and the steering committee to make sure that we're able to adapt in the future. I think Christine's slide is next.
Good morning. It's nice to be here. Thanks for having me. My name is Christina Lilovich. I'm the Assistant City Manager of the City of San Rafael. And Brian did a great job with the recognition of this effort, but so I'll try not to be redundant, but I do want to acknowledge the regional collaboration, the city and county work that's been done on this effort. When Angela asked me, would San Rafael be willing to lead this retail effort a few weeks ago? My first answer was yes. My second was, what does this really mean? And it's been a pleasure to work with all of you again on this effort. I think it's important to note that it's a prime example of what I would call good government, which is that we're really working together. What's good for San Rafael is good for all the cities and towns and the unincorporated areas of Marin. So I feel really proud to be part of this effort. I wanted to also start by recognizing the specific retail industry group, which are, the names are on your screen, but what's important to note is that this group has a good representation from across the county, from Point Reyes, Corte Madera, San Rafael, Mill Valley, Novato. So, and different size businesses and different industry types. I also wanted to mention Joanne Webster, our CEO of our Chamber of Commerce here in San Rafael, who really did a great job, not just representing San Rafael, but the perspective of business across in all the chambers in Marin. This group did an incredible job in about a week's period of time coming together, meeting multiple times over Zoom, and really trying to hone in on developing a user-friendly tool that not just retail businesses could use, but all business types could use in their reopening. So in anticipation of the May 18th reopening for curbside, the group really focused on developing the site-specific protection plan to make sure that it wasn't full of legalese and bureaucratic language, but that it was really straightforward and really got to the point of what the state requires for reopening of businesses. Next slide, Angela. So I wanted to show you what this looks like on the Marin Recovers website, so you can see, and the website is really easy to navigate. If you click on this link, that's the COVID-19 site-specific protection plan. You'll get this document, which you can either fill in electronically, or you can like literally copy and paste it and download it and develop your own plan. What we did is we wanted to create this template that was pre-approved by Dr. Willis. So what that means is you don't have to have this plan approved once as a local business. It's completed. As long as you use this template, it's considered pre-approved by the public health officer in Marin. And about 75% of the content in this document is standardized to all business types. So it basically meets the state requirements for reopening. And then the other 25% of the content is for each specific unique industry type. So what you need to do for that section, and I think I'm going to have you go, Angela, to the next slide to see what that screen looks like, is so for example, if you look on the left-hand side, it says agriculture, arts sector, children, construction. Under libraries is retail. So this screenshot is showing you what the retail site looks like, and there's reopening guidelines, best practices for curbside. If you scroll down a little further, you can't see it because it's not real time, but there's a section of about 5 or 6 bullets that the retail group worked on with Dr. Willis that's specific to reopening curbside retail. So you just have to go in there, copy and paste it, put it into your SPP, we're calling it, site protection plan, post it in the entrance of your business, and you're ready to go. So as each one of these industries, those best practices become available, they will be posted to that website. If they're not there yet, like for example, a restaurant is not there yet, you can go to that part of the website and click a subscribe link. So when there is content posted there, you'll be notified. I do also want to mention that the SPP template is available in both Spanish and Vietnamese, and we're working on providing support to businesses who need language assistance. And the other thing I think is important to mention about this process, in particular the retail group, is we worked really hard to prepare for the next phase. And I think that's really important, that even if a business type or industry isn't ready to reopen under the state or county public health orders, that if you develop this site protection plan, for example, for retail, it's set up to reopen you for curbside. But as soon as the public health order comes out that says we can now do retail inside, they're ready to go. So I really want to appreciate the group and the work that they did to get us to this point. And I think, if I'm right, Angela, we're turning it over to Dr. Willis at this point.
Hi, Matt Willis, Public Health Officer. Thank you, Christine. And I also want to just echo all of the thanks that have been already offered to everyone. For my part, as Public Health Officer, when I look across the state and see how my colleagues are engaging in this process of reopening, I hear that many feel more isolated in that process in terms of their decision making. And I'm really grateful for being part of this community where we do seek to tackle this together and really recognize that our response to COVID-19 is not just solely focused on limiting transmission, because we knew if that was our only goal, we would just simply remain locked down indefinitely or until a vaccine was developed, but that we actually do need to reopen and doing it in a way that is safe and manageable and practical ways for all of us is the goal. So the way I think of Marin Recovers is really the how. And I want to be clear right up front that a lot of the concerns I think are coming from our community around how fast we're going is, we need to reopen, as if it's a light switch that suddenly you're reopened or you're closed. And what Marin Recovers, I think, hopefully very clearly outlines, which is that it is a continuum, it is a sequence. There's a cadence of this process. Some of my epidemiology friends refer to this as a dance, right? So there's the first phase of our response, which was we were seeing exponential increases in cases, anticipating surges into our hospitals, a more aggressive and decisive decision to shelter in place that lasted for a period of time. It gave us time to develop our hospital capacity, our testing capacity, our contact tracing capacity, and give us the confidence that we do have some control over how rapidly it spreads through shelter in place measures, which is tremendously reassuring to have that available to us. And now it's about again, a gradual and sequential reopening based on risk, and this, based on the risk of any given activity, and relative to where we are in the trajectory of the epidemic in our own community. And having this resource of all of you and the partnership in terms of what is feasible within the particular business environment is invaluable. So thank you. I'm just going to go through some of the, hopefully it goes without saying, this slide shows three of the most important principles we're applying our process. Number one is strengthening self-measures. Marin Recovers is really designed to help us guide our policies, right? The shelter-in-place policies at any given place, what sectors are going to come online and how. The most important thing that we can all do to actually prevent transmission of COVID-19 in our community are the things that each and every one of us do every day in our own practice, our own behavior. So maintaining physical distancing, covering our face, frequent hand washing, not going to work when you're feeling sick, getting testing if you have symptoms. The things we've been saying over and over again are really the most important things. No policy on either side would work if we're not all practicing that vigilance. So I can't say it enough that we're really trying to establish a culture of vigilance so that sort of the new normal starts feeling normal to us. So that face covering is, it's always with you. We're keep it in the pocket of your passenger side door. Just make sure that it's always there so that when we're out and about, we sort of normalize all these things that we're going to be doing differently. Secondly, number two here, closely monitoring community health. This is the vital signs. I think about this as the way a clinician might view the vital signs of a patient. If you're trying to manage a patient, say in the ICU, there's a lot of things that are being measured. There's the pulse, there's the blood pressure, respiratory rate, et cetera, oxygen levels. these are the vital signs that clinicians need to guide what's happening. And we have an analogous process in Marin where we have very precise measurements of dozens of different indicators of the community's health as a whole. And I'm looking at those very carefully along with our team, and they are publicly available. One of the sort of the principles we're applying to this entire process is as much transparency as we can, we want to be clear with everyone exactly where we are at every step. And it's gratifying to see how many people are actually looking at these indicators and asking really good questions about why aren't we looking at one thing? And, we're actually modifying even the indicators and how we present them based on community feedback. So we're monitoring those carefully. And then thirdly, and this is essentially just, this slide summarizes what we've already been discussing in this conversation, which was establishing a set of COVID-19 safety standards, a plan for modifying our operations, and continuously modifying them. What I want to say about that last of monitoring and modifying as we go over time, it's not just categorical moving forward and then moving back if we see surges in cases, for example. It's also within our own settings and our own businesses, there will be evidence that there's a lot we don't know about this virus yet. And so the evidence continuously emerges. Remember, we used to say we didn't need to wear masks in public. We learned that we do because of the role of asymptomatic transmission. That kind of thing will continue to change. And it's my job to make sure that we're on the best evidence as timely as possible and modify our policies and procedures and bring that to you. And through Marin Covers and other groups, the Board of Supervisors, cities and towns, we can actually modify practice in real time to adapt to those things. So I think that's going to be an important aspect of this expectation that this isn't just, a static process where we're just opening, but rather one we'll continuously modify as we move forward. Next slide, please. So this is just an example of the indicators we're looking at. Marin County has been moving forward with the core 6 Bay Area counties from establishing that first shelter in place in mid-March, which was the first in the nation of its type, and I think was really responsible for the success we had here in the Bay Area. We also recognize that we are at risk of losing those gains if we reopen too quickly, or if all of us aren't doing our part in our everyday behavior. But one of the ways to track how we're doing is through these indicators that have been established, and they include our cases, our case rates, our hospitalization rates, our testing rates, our ability to perform timely contact tracing, our surge capacity in our hospitals, and our PPE supply. And this is just a screenshot of one of those indicators that the number of hospitalized patients should be flat or decreasing. I want to be clear that these are, we look at these things in their totality. So there's a variety of different metrics we're monitoring. One or another seen in isolation isn't going to make or break us in terms of whether we move forward or move back. It's really going to make sure that we understand the context for that. If we have an alternative explanation that might reassure us that we can continue to move forward. We are meeting our testing goals. We are meeting our contact tracing goals. We are, seeing that there's a flat number of people in the hospital. And it's, again, if you look at the x-axis here or the y-axis, it's only, we're looking at numbers from 0 to 4 individuals total in the county in hospitals. So those, just an example of why context is important, because I wouldn't necessarily choose not to continue to reopen if we went from 4 individuals in the hospital to 6, because it would appear as an increase and might seem to defy this expectation that the number of hospitalizations should be flat or decreasing, but understanding it in context is important. So that's an explanation for how we're going to be using our public health indicators, and concludes my portion of this presentation.
Thank you, Dr. Willis, and thank you, Christine. I think one of the things that we want to touch base on, actually, and I think I was going to.
We're back to Brian on this one, Max. Brian, you're muted.
Thanks. One of the things we want to address are the other social and economic impacts that the county is currently dealing with. The slide lists 5 impacts, and I'm just going to elaborate on them a little bit. Unemployment in Marin County is now over 11%. As a community, we need to keep in mind that it's possible that this number may materially rise in the future, and we may not see a significant decline for the foreseeable future. Housing in Marin is a constant challenge for so many members. Housing stability is at a greater risk. Third, the virus is disproportionately impacting people of color and those experiencing poverty. Let's keep those communities in mind as we deal with our own personal, professional, and community challenges. Fourth, a long-term challenge is how we can all work together to maintain the unique sense of place in all of our Marin towns while allowing for county-wide public health requirements. We're going to need to partner efficiently and effectively to balance these two concerns. And fifth and last, the loss of economic vitality is going to have long-lasting repercussions in our communities in ways that we simply can't even imagine today. We need to maintain an openness to the changing landscape and a curiosity about the realm of the possibility to meet these challenges. And with that, Max, I'll turn it back to you.
Thank you, Vice Mayor Colbert. So, and Angela, I think there's one more slide. Yeah, thank you. So, so as I mentioned in the beginning, you know, this is an ongoing and iterative process. I think, you know, I'm extremely thankful for all of the business leaders and the community leaders and the local government partners that have come together to make this work. And it's, you know, I think in this really challenging time, it has been incredibly inspiring and hopeful to see all of these people working together in such a positive way. And I felt very lucky to be a part of it. You know, at the same time, we still have a lot of work to do. And I think one thing I want to really underline is that this isn't over. And so, you know, while we're providing this report to your board, it's really documenting this process and highlighting that ongoing, you know, we continue to need to work together both to address the needs of our business and community, and also to make sure that we are helping to protect public health. We're going to continue working to you know, meet and provide these guidelines and update the business community about what can reopen safely. This is going to be an ongoing channel of communication with the public health officer, with the community, with our local governments. And then, you know, some of the other key pieces is as we hear from businesses or different areas of the community, making sure that we're providing filling important roles like providing signage or helping businesses access personal protective equipment who may have challenges accessing them. And so helping to solve those problems that arise as businesses potentially are working to reopen. And then, you know, really, I think we recognize this is a long-term partnership of helping businesses adapt to this new environment of having public health challenges that's not likely to go away in the near future. Is there one more slide, Angela? So thank you. That concludes the presentation. I just want to, you know, close by again really thanking all of the business leaders, all of the community members who stepped up. We had, I think, over 700 comments on our website that were, you know, input from the community members that went to all of those different group leaders, and addition to those of us who are leading this effort to inform the guidelines that came out, and that really every time we're able to reopen another sector, it's because of the leadership of this community and the members of this community who stepped up in this really challenging time to help us reopen businesses in a safe way and support the really important work that happens. So with that, I'll conclude.
All right, Max, thank you. And Brian and Christine and Matt for your parts in the presentation, and then Angela behind the scenes, and then all the people that you've named that have been involved in this process. It's really a bit impressive, and that was an excellent report, having watched the process from sort of the 60,000 foot level. I think you did a great job of capturing the work that's gone on and continues to go on. So I'm going to see if there are board member questions at this point. I know we have people in the public who would like to comment or maybe have questions, but first some board member questions. So Supervisor Sears, I see your fingers up.
Great, thanks very much. And thank you for those presentations, were all really excellent. I think we all know as we're doing more testing, which we need to be doing, we're finding that we have more cases. And so that first requirement of declining or flat cases seems to be sort of a moving target as we do more testing, which I'm glad that you emphasized the ever-changing nature of this circumstance. And related to that, we often, I think about the impact of customers as we reopen retail, and we think about all of our behaviors and social distancing and the interaction of individuals out in the world. But one thing that doesn't seem to get quite as much attention to me, at least in presentations, is the employees and what kind of training and work that we're doing as part of this process with our business owners to make sure that their employees are trained well and well taken care of. And I wonder if someone could address those issues. I know it's part of the form that people do need to fill out, but I didn't hear much about it in the presentations, and I'd like to hear more. Thank you.
Yeah, I can start with that, and then maybe Christine or Angela could fill in. Absolutely. I mean, I think there's an efficiency to a process where we define the best practices and then someone can download them and post them. Obviously, there's a concern there that it could be a pro forma process and not really internalized in terms of their behavior. So one of the things that actually goes into that to prevent that from happening is that they have to be able to describe what their training plan is for their employees. And the elements of that are very clear. So it's not simply a document. It's actually a document that reflects an internal practice that has to have been completed in terms of verifying that they can offer the reassurance to both their staff and customers that they've gone through that process. For example, screenings as employees come in, some are going to do temperature checks. Not clear whether that in itself is a beneficial step, but certainly we want to make sure that every single person who comes to work has been screened for symptoms, either verbally or through an attestation process, and with or without temperature checks. The process with public health is we're working with all of our employers, especially now grocers and food handlers, because that's been one of the hotspots for us, frankly, in terms of the occupations that we're seeing more cases, to do individualized outreach to all of our chains in those sectors to ensure that they actually have the best practices in place working with environmental health services. So you're exactly right. It's really about, just as we said, it's, the vigilance is for us individually as we're out in the community. We need to make sure that the employers are actually applying that level of vigilance as well.
Thank you.
Was that? Okay, Damon, just 1 second. I want to also remind the public, and I'm sorry for not reminding you sooner, if you are going to want to speak on this item, you need to press *9 to raise your hand so that you can be recognized by the moderator when we get to public speaking time. Okay, Supervisor Connolly.
Thank you everyone for the really thorough presentations and the work that's gone into these groups. Very much appreciated. So I wanted to start with a few questions for Dr. Willis and then move to the Marin Recovers group. So drilling down a little bit more on our indicators, starting with testing. My understanding is the benchmark we are seeking to hit would be essentially a weekly average of 500 tests per day. If you could confirm that, and also where do we stand in meeting our testing objectives right now?
Yeah, we have met our objectives with regards to testing with that number of 500, average of 500 per day for about the past 2 weeks. We had set that as our objective for the end of this month and actually achieved that goal even before mid-month, partly because we and public health did a lot to obtain more testing capacity, entered into relations with UCSF where they're going to do 200 tests a day. Our public health lab at the state and the regional lab is also doing more testing. So those things we have control over in terms of public health have been optimized. We now have 4 lanes of people moving through our point of testing site in Central Marin. And then the state also opened a new testing site in the Canal District where they can do 132 tests per day. But also at the same time, many of our healthcare providers also increased their own testing capacity, and Kaiser is doing a lot more testing now. So the sum total of all those different actually sort of almost surprised us in terms of a really rapid acceleration in terms of reaching our testing goals. I've seen just on some of the comments and some of the questions that have come to me is that it's important to know that when we look at the way the indicators are actually listed on the website, it's a rate. So it's a number of tests per 100,000 residents, not just the number of tests. And the reason we use a rate, whether it's for hospitalizations or cases, is it allows us to compare counties to counties. Because obviously it wouldn't make sense to compare Marin to Los Angeles, for example, where we have 10 million people, and just in terms of raw numbers. So we have to adjust it to a rate, and that rate is per 100,000. So in terms of testing, it's about 200 tests per 100,000 is our goal. And that because we have 250 or 260,000 residents, we multiply that by 2.6 to get the actual absolute number. So some people are seeing that 200 and thinking that's the number of tests, but it's actually, that's the rate per 100,000.
So in terms of that state set indicator, we are meeting that, right?
We are meeting, yes. Sorry, long answer to a short question. Yes, we are meeting that.
No, thank you for the detail. That was great. Another indicator is number of incidents or cases per 100,000 people. And on that score, as you noted, and I'd like you to perhaps elaborate, our numbers are not where they would need to be to meet the state standard at this time. In other words, we have a rate of incidence that does not qualify for a state variance.
Yeah, I think this is an important point just for everyone, is that Marin County is part of a national, really a national hotspot. You know, the core Bay Area of California is one of the hotspots nationally for COVID-19 and has been from the start. Santa Clara County was one of the first places to light up nationally. We have, you know, fortunately, we were able to get in front of this with the shelter in place, but we remain, the 6 core Bay Area counties are all in the top, 20 of the state counties. We're number 16. So our incidence in Marin County is 16th highest of any county in the state. And we have, I think, 9th highest overall death rate. And so, some of the questions I hear, especially from like the northern portions of the county that are closer to Sonoma County and may sort of align with Sonoma County in terms of their understanding of where we are. It's important to recognize that Sonoma County's incidence, they have 4 total deaths. We have 14 deaths. Their population is twice ours. They have just slightly fewer cases total, but again, their population is almost twice ours. So the rate is much lower to the north, and our rate is much more closely aligned to the south. So in terms of the epidemic, this virus is affecting our community much more in our relationship with the core Bay Area, more urban core, than it is with the rural north. And that's why our decision making has to be based on that reality rather than, and so people may look northward and feel as though, why aren't we taking the steps that they're taking? And the simple answer is that they have fewer cases. They have fewer, the burden in those communities is lower, and it may make sense for them to move more quickly than we can.
Thanks. And it certainly hasn't gone unnoticed that of late, meaning the last week or two, the number of positive cases seems to be going up. And I know you've done some analysis of that. What have you found?
Yeah, we have increased testing. I mean, I think one of the most important things that we're learning, as we all learn about how this virus behaves and the best way to address it, is that, I think back to the way smallpox was controlled, for example. There's diseases where it's very clear when someone is infectious to others and they're affected just from their appearance, or the symptoms are very obvious. the problem with COVID-19 is the role of asymptomatic transmission. It becomes a huge challenge for us to control an epidemic that is manifest so frequently in people that do not have symptoms. And the only way to address that is through testing. And so we are being much more aggressive in our testing strategy. In fact, reaching that 500 goal, we're seeing that we probably need to be doing even more. The way we framed it was 500 to 1,000 tests. We're going to need to continue to increase our testing capacity, even though we've reached that first goal of 500. And so we are testing in now targeted ways in communities that we know have higher risk and higher burden, especially those communities that are made up of people who have been on the front lines, out our core workforce, people who have been out putting themselves in harm's way in some ways, whether they're working in healthcare sector or grocers or those other essential businesses we all needed to be able to sort of manage our lives. And what we're seeing is that, as you might expect, unfortunately, those individuals are numbers. And so we're being much more targeted in the way we're testing, and we would expect to find in communities like the Canal in San Rafael, other parts of Novato, increased rates of disease, or rather increased testing positivity because of the more aggressive testing we're doing. The site that was opened in the Canal by the state, 132 tests a day. We're doing more testing in the Canal district later this week. That's partly because we know that there's a higher risk in that community because of the fact that they've been out in the workforce. And that's the explanation for why we're seeing more positive tests over the past, say, 10 days, is based on that more evidence-based and aggressive strategy for testing in high-risk communities.
And meaning communities where you have people working in healthcare, working on the front lines and other essential services.
That's right. Right. Yeah.
Right.
And we owe it to that. I mean, we owe it to them to do what we know is the standard of healthcare right now, which is testing people who have been potentially exposed, and that's what we're focusing on. And we're seeing a corresponding increase in testing rates and in positivity rates. So the proportion of positives has not increased as significantly, but the number of tests has.
Perhaps I'll ask you, Dr. Willis, but also to the group on the significant amount of new activity that will come online June 1st, including summer camps, outdoor dining, if allowed by the state. So is it correct that currently you actually do need to seek a variance to allow outdoor dining in a community, a variance from the state?
The state has not included dining yet in its allowances.
So we're going to seek that.
Well, we would, the state is moving quickly. I mean, they just went to all indoor retail is allowable now by the state. We don't think that's a step, again, based on our burden and our experience, a step that we're ready to take yet in Marin County. But it may be worth just stepping back a second to sort of understanding what the thinking is around what is risk versus, high risk versus low risk. So I think it's important for all of us to know what's sort of the driving principles behind these from an infectious disease standpoint. In order to become infected with COVID-19, you need to be infected with a certain dose. And it's thought to be around 1,000 particles, virus particles. And it's transmitted through droplets when people sneeze or cough or breathe into the air. They might settle on surfaces or move through the air. That's why that 6 feet is so important. Most of the time it's, so it doesn't travel very far. And if we're covering our face, then we're not transmitting those particles into the air. And if we're maintaining a 6-foot distance, it's very unlikely we're going to be infected. However, the longer duration of time, the closer we are, the higher the risk that you're going to reach that infectious dose if someone around you is infected, because even regular breathing will release some amount of virus particles. Things that happen indoors, that's, when we look at the 80 or so outbreaks that have been described in the United States over the past 2 months, almost all of them occurred through indoor transmission. It makes sense, right? Because outdoors, there's more ventilation, there's more opportunity to socially distance. And so one of the guiding principles for us is really favoring outdoor activities. And you can see that in the themes of everything we've brought online so far: construction, landscaping, camps, outdoor, parks. We're going to start applying that principle to retail, to the more core economic activities, including restaurants and retail. And that's why you see Marin actually moving forward, maybe even faster than the state might allow in terms of outdoor dining, because we understand that, you know, especially if Marin County, if our people are able to actually adhere to those standards of safety, we have the weather that would allow it. And we're working through the Marin Recovers Group, I think, offers the reassurance that what we do, we can do well and we can do safely. We are open to the possibility of actually opening outdoor dining as early as June 1, based on that epidemiologic understanding that activities that occur outdoors are lower risk, and having the confidence that our people can actually do these things vigilantly.
Yeah, that's helpful. And so in fact, as of June 1, and this assumes, you know, between now and then is a lifetime, as we know, in terms of the possibility that Governor Newsom and the state may issue new directives, et cetera, and it's an ever-changing environment. But as things stand now, as of June 1, in effect, the only thing that Marin wouldn't be doing or allowing, if that's the right word, that would otherwise be permissible under state guidelines would in effect be like indoor retail, right? So basically, otherwise we're on par with where the state is, including outdoor dining, et cetera.
And indoor worship services.
Right.
Okay, so indoor worship services, we do not have a time frame yet.
No, but outdoor, another way, you know, again, that what has traditionally been conducted indoors, moving it out of doors, that's another category where outdoor worship services would be much sooner than indoor.
Okay, so final question then, and you've hit on this in the past, it's kind of that anticipation of a 2-week look once new directives come in place. So are you and the group in effect already looking to the next group after that at a couple week interval in terms of what happens next after June 1?
Absolutely. I mean, it's a continuous process. The 2-week cadence is based on the incubation period of COVID-19, and an assumption that as we open up, we do increase opportunities for transmission of disease, and that's an equation I think we all need to understand that it's very difficult. We can't have it both ways. We cannot open up and not expect to see more cases. And again, the only way we could guarantee that we're not going to see more cases would be just to stay sheltered in place until a vaccine and that's not a possibility. So so our process is looking every 2 weeks and then doing that judgment call of saying, is this, can we explain, if we're seeing increased cases, can we explain where the source is, how it's occurring? Can we be confident that we can control that particular contributor to the incidence? Or are we seeing more widespread community transmission, in which case we wouldn't move forward? So June 15th would be, I'm hesitant to forecast beyond June 1st, but June 15th, what the state has allowed becomes sort of a signal for us of where we might move forward as well, because the state is, again, sort of giving us permission to move forward in certain directions based on the epidemiology and the good thinking that's happening at the California Department of Public Health. And that's sort of a soft signal for us of what people might expect at the next 2-week cadence, as long as we're not seeing surges.
Great, thank you, Dr. Willis. And then Max, maybe to you, and this is my final question for the time being, but summer camps, a huge issue for our families as we head into, or actually as we're upon that season right now. Could you elaborate on where things stand with summer camps right now?
So yeah, as the father of a 6-year-old, this is one I'm very familiar with. But I think, you know, we've heard that a lot, is that both from the, you know, different organizations that operate summer camps looking for some early guidance, and then also from parents trying to understand what the opportunities are for childcare as they seek to go back to work in some of these areas that we've provided to reopen. you know, that this is something that's really important. And I think this is one of those efforts where we've tried to work with what's come out of the advisory group to provide guidance early on that can help the businesses to formulate their approach. So what we've provided is some guidance that says, you know, summer camps, childcare, and sports camps can operate within certain parameters. They have, you know, smaller groups. They can operate for no less than 3 weeks at a time for these cohorts. The cohorts can't, you know, mix with each other, and they, you know, are operating outdoors. You know, there's additionally, you know, some of the feedback for this, you know, is we still haven't gotten the okay from the state yet in terms of allowing summer camps. This is one where we're trying to forecast what the state is potentially going to reopen, so that we can provide the guidance early on, so that once the okay comes from the state, that we can we have the guidance there. The businesses have done their planning and they can reopen in accordance with that guidance. Angela, I don't know if you want to add anything else about that.
Yeah, so effectively, we issued our guidance on Friday of last week, and we are hoping that it will be effective June 1st, because we know that schools are ending mid-month for most people, the 10th, the 11th, the 12th in there of June, and kids need to have a place to go so that parents can go back to work. So the hope would be that on the 1st that will open, and like Max said, we really duplicated our pop-up childcare that we've been running in the county very successfully since the beginning of this epidemic. And we have been very careful and thoughtful about how we're doing it, and have seen great success. So it would really duplicate the pop-up childcare program that we've been running for the last 2 months.
Thanks.
Supervisor Rodoni, did you have a question? You have to unmute. Dennis?
I'm good right now. I'll wait and make a comment. Thanks.
Okay. All right. And one follow-up to that last question, Max and Angela, and then we'll go to the public. And again, I'll remind the public, if you're going to want to comment on this item, you need to press *9. My question is on the camps, because it actually is one of those areas where we're ahead of the state in terms of actually even developing guidelines, I gather from what you've said. And what I'm wondering is if we're sharing any of that work with the state.
Yes.
Yeah, Matt probably is best to speak to that.
Yeah, I mean, this is an area where being part of this collaborative in the Bay Area has been really helpful for us to sort of think through these. I think we all share an understanding that our children need places to recreate, and especially if we're going to be mobilizing the workforce, we need places for childcare. And in the summer camp, childcare takes the form of summertime. It's camps. So we are sharing with the state what our thinking is. You know, one thing that the state is not yet allowing that we have included in our summer camp guidance is pools. So if there are cohorts of kids that do 12 kids who use pools on a regular basis for a swim camp, you know, the pool itself is not the risk. It's the way people tend to gather around pools. So we would be, according to our order, allowing kids to do that, and the state doesn't yet. And what we found is that, you know, sometimes the local can translate vertically back up to the state to sort of accelerate our statewide progress around certain indicators.
So that might be a good example where the state says, okay, green light on summer camps in this construct that's been laid out, 10 kids, whatever it is, 3 weeks, but we're not going to allow swimming. And that's where we would have to modify ours. We wouldn't.
That's right.
We would. I'm just towards us kind of.
Yes, exactly. Yeah.
And I think, Katie, we actually, in the original shelter-in-place order, we were very specific about childcare, and that was actually that was brought back to the state level, and I actually participated in a couple statewide education calls talking about our model, our childcare model. So I absolutely know that it's gone back up to the state level.
It's great. And then we're also backing it up because we're doing the testing and really monitoring those groups. So we actually now have a track record working with those, that child care. So we can have some level of a real level of confidence with the data and the evidence. So that's good to hear, and good to hear that we're helping the state out.
Yeah, and our childcare partners and our education partners have been amazing, and those are very active relationships. And so, and they are primarily focused on the children, and so that has been what has unified us throughout this entire process. That's always been the focus, and so we've really appreciated their participation and collaboration.
Okay.
And Damon asked, our Supervisor Connolly asked about, you know, where are we in relation to the state? This is one area where we tend to actually be a little like right ahead, even a little bit ahead of the state in terms of our relationship with childcare. And again, we see that as a necessary complement to the other things we're doing. So Marin, you know, debating based on our local culture, our local needs, our local understanding, and what we see as the evidence base, we'll sometimes actually be pushing the state, and not just, you know, not just behind the state.